So you're welcome once again to my YouTube channel. Just subscribe. Today I'm still your humble resource personnel, the nurse psychiatrist and the mental health personnel, I'm a psychologist. I want to really emphasize on what I title the psychology of drug abuse. But now I want to go straight to what is drug rehabilitation. How do we try to intervene for drug addicts? The only solution is by going into rehabilitation. What is rehabilitation? Rehabilitation is a process of bringing an individual out of his problem and putting him back to his pre-functional state. I can also paraphrase it as a process of rebuilding a deteriorated entity psychologically, physically, and socially. Can also be directed. It can also be defined as a goal-directed intervention that focus on the aspect of making sure that someone or an individual that is in problem is out of the problem, and coming out of the problem can be by the intervention of a trained personnel, more especially a psychologist, a trained psychotherapist, a psychiatrist, a psychiatric nurse, a social welfare, a guidance and counselor, and other mental health personnel. These are people that can do well in this particular therapeutic intervention. So psychotherapeutic intervention is a tool in rehabilitation. Yes, we know that in drug abuse with rehabilitative intervention is not done in a day. It is a long-term process where that patient and the psychotherapist or a psychologist, a psychiatrist, or a psychiatric nurse trained in this special area is being establish a therapeutic relationship, very long term therapeutic relationship, to make sure that the individual is being given tasks that he will be able to overcome that urge or crave of going back to drug addiction. So in rehabilitation, we have so many techniques used in rehabilitation. First of all, you have to understand the following: that one, that the environment is conflictogenic. Then the environment is important to understand. One other thing again you understand is the individual preference. That particular individual, what he loves best at his leisure time. Then another thing you have to know again is you as the therapist, your own awareness, your own preference is also of more of concern, because you cannot, in the course of trying to bring somebody out of problem, you put yourself into problem. There is a very big, you know, bridge between this. But let me not call it bridge. A very big link between this. You may be trying to bring that person out of the problem. The person will automatically convert you back. I've seen a scenario where an addict have made a therapist to become an addict. So in this scenario now, you have to build your mind and be confident and be very, self-oriented, and have that self-awareness that you are going for a very strong task. So in in doing this particular intervention, you also consider some ethical consideration, things like autonomy, and you still go into confidentiality, and you still go into let call it um, let me use the term because I want to use one term to coin it up. Self-respect, respect the individual, and make sure you follow what they call non-malevolent and beneficiency is also more important because you should make sure the patient benefits from your therapeutic intervention. Non-malevolent is in the course of your rehabilitation, don't hurt the patient. Try to make sure you're bringing the patient out not to hurt him. All these ethical considerations is also of important in terms of bias. Don't be biased. Allow the patient judgment. Let him be open to his own judgment and then know how to, tackle his judgment. So allow the patient to air out his feelings while he's into the drugs and now advise on the importance of the willpower that you are only trying to tell him, suggest solution to him, that he has the final decision. Make it known to him that he has the final solution. I'm trying to tell you that if you say it, he will have that remorse. Another thing again is be a good listener. You must be a good listener. Try to hear the patient aspect of problem. Why he will go into drugs. Ask him all these questions. If possible, review his past case study, his condition, if it is medical history, if it is taking it from the significant other, that is the relative of the patient, and if it's either through depression or disappointment or anything that made the person to go into drug, try to explore all this particular intervention. And when this intervention when you explore these particular issues, this particular underlying condition that may precipitate that individual into going into drugs, you cannot be able to know where to channel your therapy, your treatment, because they say problems in fact they said that when you have find this problem, it is half solved because the cause of a problem found is a problem half solved or solved and to an extent. So another thing again is you have to also go into the genetic history of this patient in their family, if there is an addict or if addiction is common, because I know that there are some family that have that genetic addictive tendency. So the possibility of the individual going into addiction is there. So if it is genetic related, you also know how to address that. So from there, explore and know the reason behind addiction. So in rehabilitation, I told you before that the environment is conflictogenic. Yes, remove the patient from the environment, take the patient to a place that the drug is not close, where he can have access to the drugs, and from there the patient will now be able to stay without drugs. Very soon I will talk about what we call withdrawal syndrome, because after taking the patient out of the environment, the patient will come up with withdrawal syndrome, which you can't kill the patient, but you being there as a specialist, as a therapist, as you have to observe those withdrawal syndrome and document and intervene. So at this particular point, you now make sure that you are doing the rehabilitative function as a mental health personnel. So I want to urge everybody that have that challenge of drug related condition or a relative to always assess any any person that can provide assistance or go to a rehabilitation center or a mental health home, or just make sure you go for assistance. Don't remain in Adam. This world is not that world where people can die without information. They say that is not informed, is deformed. That is what I want to tell us. So rehabilitating a drug addict is very, very important. Thank you. Please subscribe and make sure you click the red button. And when you click the red button, you will get more of my information on psychology of drug abuse. I remain your humble resource personnel on psychology of drug abuse and addiction. Thank you.